This is something that Professor Kapos, Ludwig Kapos, who's the person who coined the term of PIRA, is that PIRA is a clinical concept. So in a way, it's what we see happening behaviorally in our patients, so that there's a stepwise worsening of disability that you can capture with EDSS. So it's a purely clinical definition, concept. But obviously, we always want to know what is behind in terms of physiopathology, the pathological substrate underpinnings. We also know from MRI studies, particularly, that there are some neurodegenerative processes that are already ongoing from the very beginning. And this is work by us and by others, showing that after a first attack, or even before, at the radiologically isolated syndrome stage, there's increased atrophy development in these patients as compared to healthy subjects. So it's easy, and it has been done recently, and it's a publication from the team in Basel, Professor Kapos, Alessandro Cavoli is the first author, Cristina Granciera among them, shown that there's a direct link between patients presenting with progression independent of relapses and atrophy development, and also particularly at the gray matter fraction of the brain. In a way, this is something that we could say, okay, we knew this from the past, but using this new concept, PIRA, it has been also shown and remarked. The sort of first-hand underpinning is neurodegeneration as seen globally when we measure atrophy. The other parameter that we are now measuring, and that is also a newcomer to the MRI arena, is the so-called slowly expanding lesions. So these are lesions that concentrically increase their size. So you could say that there is no active inflammation in the sense of gadolinium enhancement or lymphocyte invasion, but this is a slow-burning type of inflammation, which is thought to be caused by activated microglia at the rim of the lesion. This is another possible culprit for this neurodegenerative phenomenon that may be associated with PIRA. As these two pathological underpinnings, we know they also occur early in the disease course, particularly as well in CIS, and it's been worked by us recently, but also in relapse and remitting MS, and it's not confined to the progressive stages of the disease, as I mentioned before, just trying to join everything together.